COVID-19 was declared a pandemic by the World Health Organization (WHO) on 11 March 2020. On March 20 this same year, Zimbabwe recorded its first COVID-19 case, and it joined the rest of the world in initiating programs to respond and mitigate the effects of the pandemic. Fake news on COVID-19 fueled poor adherence to recommended preventive measures. The situation prompted the Community Working Group on Health, CWGH, with support from Internews through the Rooted in Trust 2.0 project and working in partnership with the Ministry of Health and Childcare to embark on a project of demystifying rumours, misinformation and disinformation around the COVID-19 pandemic. The project covered Bulawayo and Masvingo Urban, Chiundura communal area in the Midlands province, and Mangwe and Bubi in Matabeleland South and North respectively.
In the initial stages, there was an information gap that resulted in misinformation, disinformation, and also anti-vaxxer, and even science denialism. So as a result, it then contributed to the low uptake of vaccines. Majority of the people, because of lack of credible information, they then depended on their peers and even on various social media platforms, for information. So for us as CWGH, the partnership that we then had with the Internews and with support from USAID to train the community health monitors really helped in demystifying, the rumors.
Since 2022, Internews has been engaging in a program of contributing to the management or the mitigation of the spread of rumors and misinformation on COVID-19. And primarily because the advent of COVID-19 led to an infodemic. As people were trying to understand what COVID-19 is, a lot of information started to circulate, and some of that information was difficult to verify. Some of it was fake, some of it was false.
We identified what we call community monitors, a total of 12 per area, who were representatives from the communities, either from existing community structures or from our existing CWGH structures. So what we tried to do was to have a diverse range of community monitors, from young people to the elderly, but looking at people who already work in the community, people who are trusted sources of information, people who have the ability to engage the community. And these are the people then that we then capacitated with accurate information on COVID. We capacitated them with information and skills on rumor collection using a toolkit that is called the Kobo Collect.
Some of the people resisted to go to the clinics for vaccinations, saying if we get vaccinated, we will die after 2 years. That is a rumor.
Young people feel COVID-19 is not something that was there in Zimbabwe, but COVID-19 came from other nations like Botswana and South Africa.
The rumors that I've gathered so far are the rumors of the religious sector, whereby the churches say all those that got vaccinated are the agents of the devil.
We developed a toolkit for our community monitors. It's just a basic information toolkit on basic information around COVID-19 and also the importance of rumor collection.
The toolkit is such a useful tool that has made us to realize and understand the concept of COVID-19 and how to deal with it.
We got change stories of some who were able to start practicing sustainable livelihoods out of those programs that we were doing with them, because they managed to not just understand what was going on when it came to COVID-19, but they also managed to come beyond the mental stresses that came with the whole aspect of COVID-19.
When COVID came in, we did manage to use our experiences of dealing with HIV to manage COVID.
We have been mobilizing entertainment, maybe sports, soccer, and as well as netball. And we invite the youth as well as the adults. So after that, maybe the community monitors are given a slot so that they collect the information either through the focus group discussions or through group gatherings.
Community members are now really a bit very much aware of that COVID-19 is still within the communities. It's something which they cannot just say it really has passed on.
People have been able to, we're now in a better position to appreciate that not all information is fake or is correct, but there are certain information that we need to always fact check.
This project has made a very huge impact, and it has also enhanced the capacity of our community health workers in terms of collecting information using, the mobile technology, moving away from the paper trail.